Hello, everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. As always, 15 minutes chock full of information. How are you today, Doctor?
Fantastic, Jim.
Beautiful sunny day. Hopefully you got your sunlight today.
I got my sunlight. A lot more than 5 minutes, I can tell you that.
Well, we will obviously want to continue with our age group series on hormone therapy, in this case, bioidentical hormone therapy. Let's talk about the 46 to 60-year-old age group, both male and female. We've covered the 20 to 30. We've covered the 31 to 45. So now this group tends to have older kids. Some are in their second phase of life, so to speak, going through menopause, et cetera, et cetera. So let's start with the male in this case. What are you seeing?
The one phrase I get for both men and women is, "You gave me my life back." I can't believe I'd feel this way again. I don't know if I ever felt this way before. Every single day. And that's, I used to be a pelvic surgeon and deliver babies. And it's like, it was fun watching a problem become a beautiful outcome. Same thing here. Every day we hear that. And it's exciting because, especially in this age group, kids are older or gone. You travel with your spouse. You may want to play golf, play pickle. Pickle is a big one. We have a huge pickleball population. And they're living life. They're not existing. And this is, you've worked 40, 50 years of your life to enjoy the next 30, 40 years. So can we push chronic disease out? That's the bottom line. We're all going to pass away. I understand that. But can we be healthy until that happens? And that's what we're hearing every day, Jim. So the dudes are really, they're getting their strength. Think about it, over the age of 65, number 4 cause of death is falling down. We're not going to sit back in a rocking chair at 60 or 80, I'll say, and go, "Oh, I wish I had less muscle." Got to build it now. So this is an opportunity to do, and you can build muscle at our age with the right fuel. Yes, you exercise properly. We know grip strength is crucial. There are things we could do to do that, but the muscle will not be its best without testosterone. The bone cannot form without, in men, testosterone, in women, testosterone, estrogen, progesterone. These are things we could actually help alleviate. 25% of men have osteoporosis. We just say that's not. Sarcopenia is not losing muscle, it's being skinny. It's losing actual strength. These are important things we could help alleviate altogether.
So what's in this age group? What's the average male coming in at from a testosterone
It's interesting. Reading? They're higher than my younger guys, but they're probably between, say, 280 and 400. Very, very rare. But a little side note, I know vividly, we've had 7 people over 800 in their first visit. Remember, in the 1940s, the range was 900 to 1400. And of those 7 people, 6 were over the age of 80. They came because their kids were on it. Their 50-year-old kids were on it. They were just beasts. And I said, "Dude, what's it?" I don't know. I'm here because my younger son's on it. So the answer is, it's very, very rare, but that population is a little bit higher. But still, it's the same symptoms, Jim. If you're a 60-year-old man or woman, I'm tired of brain fog. And the problem is, we call that aging. If we attacked aging as a disease, you want to eliminate the chronic aspect of it as soon as you can. Why wait for osteoporosis? Why wait for a heart attack? Why wait for dementia? There are ways to push those things out by what testosterone does to the body. But a woman is different. Now, a woman has 3 hormones. Let's go over the woman right now. So when a woman stops having her cycles, she still makes estrogen from fat conversion, peripheral conversion, but it's a much lower. There are 3 estrogens in a woman, E1 and men too, E1, E2, E3. E1 is made from fat cells. E3 is made from the placenta when a mommy's pregnant. E2 is made from the ovary. What's important, there's 2 what's called estrogen receptors. One's called alpha, one's called beta. Simplistically, alpha is not that good. Beta is better. The one that dominates in menopause is E1. And that's 5-to-1 alpha. That's probably why maybe breast cancer increases as you age. The one that dominates when you're younger from the ovary is E2, is actually neutral. In fact, estradiol actually decreases its own production of the breast tissue and turns on progesterone receptors, which actually negate breast cancer. And Dr. Glazer's studies out of Ohio, there's actually more testosterone receptors in breast tissue than estrogen receptors. Actually downregulates proliferation, actually anti-cancer. In her studies, she's up to 40 to 60% of decreased breast cancer on testosterone pellets.
Yeah, I was going to say, this is a pretty tough age group because this is usually where the chronic disease and the cancers, I mean, it seems to hit this age group worse than it does any other age group. Do you have a theory on that? Is it just life? Is it just age?
I think well, first off, what's caused cancer? No idea. So is there more time in that environment? We do know that cancer, cardiovascular disease, diabetes are also extremely much higher today than 100 years ago. Now they'll say we're better diagnosticians. I don't know about that. We died of dirty water and trauma. Okay, scarlet fever went away with no vaccine. It went with clean water. Cholera, clean water. So the things we're doing with health that'll help a lot. Clean water is crucial. Okay. Why? But you find now though, Jim, especially the last 4 or 5 years, we're having earlier cancers, earlier turbo cancers. People found a stage 3 and stage 4 much earlier. And a lot of in GI cancers, rapid producing TELS type of cancer. So I don't know, but I know our immune system is being beat up, and testosterone actually helps strengthen our immune system.
Yeah, because I mean, you hear about it all the time when you're in your 50s. You know somebody has prostate cancer, and then they, for some reason, go get a prostatectomy instead of getting it treated. But that's their decision.
Right. Well, that's it. Give our prostate cancer up, Jim. Testosterone therapy causes prostate cancer to grow. Everybody says that. Well, stop and look. Dr. Morgenthau at Harvard, urologist, they wrote a book called Testosterone for Life. And he goes in his book, he goes through that actual phrase. World famous paper, Dr. Huggins and Dr. Hodges, 1941, University of Chicago. In fact, Huggins won the Nobel Prize in 1966. So real science. How many men were in that world famous study said testosterone therapy causes it to grow? One. One man that's quoted today. So 80 years later, he had no testicles. He was castrated. Dr. Morgenthau talks about that roughly around 90, at 90, the prostate gland is saturated. It can't make it grow. He has an interesting study where he shows, it's only 13 men in his study, but 13 men with prostate cancer. They have prostate cancer. He biopsied himself. He gave him pellets, which is testosterone. Rebiopsied him 2.5 years later. 56% had no prostate cancer, 40% no change. Then he has a study with a couple thousand arm where prostate cancer, yes pellets, no pellets. The ones with yes pellets had less recurrence, less heart attack, less dementia. So the bottom line is, and you look at it just logically, an 18-year-old boy has never had prostate cancer. Why? That's his testosterone is highest. Well, not today's population, but in general. And there's a book by Dr. Friedman talks about that might be called the endocrine hypothesis that testosterone suppresses estradiol formation. It might be the estradiol in the environment, it's the fake estrogens that actually cause it to grow.
Female.
Yep.
This is the menopause.
This is the big one.
Before and after symptoms.
Okay.
Once you're on
this
treatment.
This takes me personal. I was a gynecologist for years. A woman comes in, 49, 50, starts skips periods, decreased libido, anxiety, mood swings, just feels, she knows she's not depressed. She knows she's not anxiety. She just feels bad. The standard of care is an automatic reflex antidepressant and SSRIs. Reflex.
And what is that doing? Why is the doctor prescribing that?
It helps hot flashes.
Okay.
Now, hot flashes are very interesting. Hot flashes is a sign you're low estrogen. In fact, a Harvard paper about 3 years ago shows if you have hot flashes, you have a 200% increase in heart attack because it's a sign of endothelial damage of the arteries because the endothelium needs testosterone estrogen to stay frictionless. So hot flashes is a symptom because estrogen also protects the thermoregular part of the brain. So these SSRIs block that. Doesn't heal anything, it just blocks it. So again, I'm gonna use this over and over again. I'm a diabetic, I lose my insulin, and I give you SSRI. We would never do that. We would give insulin.
Right.
So my thought was, women are just, here's goodbye, it's in your head. Drives me crazy. It's not, it's in their head technically, because it's in their brains in their head. This is how they feel. The whole hypothesis behind SSRI is very interesting. The serotonins, the norepinephrines, the dopamines, they're not even made in the brain. They're made in the gut by bacteria. How many doctors give you probiotics for depression? Like nobody, but they should. That's what helps. So my thing is, let's make their chemistry youthful. And there's debate on how much insulin you got to go. But Dr. Tutora papers talked about, he liked to keep an FSH over 23 is menopause. So keep it under 20. And then also you balance with progesterone. When you have you need to balance out with the progesterone. Progesterone does more than protect the uterus, helps protect the natural progesterone, helps protect against heart attack, dementia, and breast cancer.
So the body's going through menopause. It's just that this testosterone alleviates the.
It's through menopause because you trick your body that you're now 21 again. Okay? And that sounds crazy, but the biochemistry does not know its age. So if you keep these hormones in youthful numbers, the cells have more chance of being healthier as they're youthful.
But you're still going through menopause.
Well, technically,
You're not turning into a fertile 20-year-old again.
you're going to be thought your body will think it's fertile, but it's not.
Right.
Exactly.
Right.
So therefore, you have muscle tone.
Mm-hmm.
You have elasticity of skin. You have less wrinkles. You're making bone. You're making tendons. You're making muscle. The biggest one, Jim, 75% of all Alzheimer's patients are women. Women go hormones like this, fall, boom. They have a higher chance of dementia and Alzheimer's. Men gradually lose, again, because of the environment. So it's that rapid loss that increases that idea of it. So, and very interesting, the brain's 80% cholesterol. And the cholesterol molecule in the brain, the one your liver makes, cannot get through the blood-brain barrier. So what happens is there's certain cells in your brain called glial cells, the support system of the brain, that actually make cholesterol. But if you get a statin that goes through that, you block it, and actually you have increased chance for dementia.
They don't tell us that. Okay, so the
woman is this, is you got to make sure you balance them correctly, because if you give too much estrogen, too moody, breast tenderness, and you can break through bleed. So you want to make sure that you keep them in levels where they get the benefit without the side effects. But there is no increased risk in uterine cancer or breast cancer. In fact, that's the big one, Jim. From 1935, the first time we gave hormones to women, testosterone pellets, to 2002, the famous WHA paper, that paper said for 77 years, not one major paper that hormones cause breast cancer. In July of that year, the WHA paper came and said, hormones cause breast cancer. What they use? Premarin, which is pregnant female horse urine. Remember I talked to you about E1, E2?
Mm-hmm.
That's a horse E1. Okay? That arm. By the way, that arm had no increased breast cancer. Had increased blood clots, but no increased breast cancer. The other arm was medroxyprogesterone, a synthetic progestin, and Premarin. Then increased breast cancer 24%. So next day in the news, whoa, hormones cause breast cancer. There's a great book called Estrogen Matters that tears that paper apart. Dr. Fiornero did a study in France, 2005, 2007. He gave him estrogen bioidentical, progesterone bioidentical. It decreased breast cancer 10% because the breast now thinks it's 30 years old, not 60 years old. Bioidentical estrogen pellet with synthetic progestin increases 69%. It's a synthetic progestin. And then Dr. Glazer, she does not use estrogen at all. She only uses testosterone pellets. And she showed in her study in Ohio between 40 and 60% decrease in breast cancer.
So obviously phenomenal stuff. What are some of these subtle improvements a male would see at that age group? I mean, we talked a little bit before about he's going to have more energy and other things, but some of the other subtle things we don't normally talk about.
Subtle thing is, I'm motivated again. My brain fog, it's not my job or whatever. Clarity of words, memory, short-term and long-term memory, and and strength. Strength is really important. Again, Dr. Atiyah in his book Outlive talks about his great videos on this stuff too. For longevity, nothing more important than hanging from a bar. If you hang at 2 minutes, you're an Olympic athlete. So grip strength, those are crucially important things. And we have studies to show that giving testosterone actually helps grip strength. So subtle things, just everyday living, Jim. I mean, it's going to sound a little nerdy, but getting off the toilet, the hip muscles, getting up, just living life.
Yeah.
We don't have to age at that kind of rate. And that's why it's important to sleep, eat properly, exercise, remove as much stress as possible. But I don't believe you could do those four optimized without those hormones. So restore your hormone levels.
Yeah, I think also just the subtlety of just enjoying life, right? You want to ride a bike for leisurely bike ride, you can get on it. If you don't have that ability to do that because you're banged up, then you can't enjoy that bike ride.
We waited
right?
our whole life. I saw this little meme. Their older couple are in Venice, and they finally want to go to Venice, and they're out cold. You know, they're on the boat. They can't even move. Right? No, we don't. There's ways to increase your strength and stuff. There's ways. And the thing about it is your quality of life does not shorten your life. It's just the opposite. It actually does both. When you're healthier, your health span and longevity go together. In fact, Atiyah's book has a great graph showing that. It goes out that direction. You know, you're not, I'm better for a shorter time. It's just the opposite.
And in this age group too, you're obviously recommend some supplements.
Yeah, the big supplements are very important. Vitamin D and iodine are crucial for the body. Vitamin D affects over 2,000 genes in our body. I really recommend eating, I'm a big believer in egg yolks and eggs and red meat. If you have dietary restrictions, that's your call. But the sad part is a lot of vegetarian diets in America, that is, are so soaked with glyphosate, they're actually bad for you. Sometimes people just market things.
That's Roundup, right?
Yeah. Kale is not healthy. It's crazy what we've been told. We fall in these fads. I want to go back to how we ate for 6,000 eggs and meat and walk and lift heavy things twice a week. That's what we ought to do. And these hormones help us do that.
Well, come see us, everybody. Thank you again for another 15 minutes of great information.
Thank you.